As we get ready for the No Surprises Act to take effect January 1st, 2022, the Centers for Medicare and Medicaid Services are preparing some memos and guidance for both healthcare providers and insurance companies. In a most recent memo, CMS gave healthcare providers and insurers directions on what to include, what kind of required language they need to use, and contact information when they're talking to patients. This must be included in certain disclosures related to the No Surprises Act. They have also launched a complaint line. Individuals can now submit complaints regarding potential violations of the No Surprises Act directly to the federal government. Now, let's remind ourselves what the No Surprises Act is, and then we'll talk about the new memo from CMS. The No Surprises Act forbids patients from receiving surprise medical bills when seeking emergency services. It also forbids patients from getting a surprise medical bill for certain services at an in-network facility when the care is provided by an out-of-network provider. And like we said, the No Surprises Act takes effect January 1st. In the memo from CMS, providers and insurers have to make sure that they give a one-page notice that includes clear and understandable information to their patients. It has to describe the restrictions on providers and facilities regarding balance billing in certain situations. Any applicable state law protections against balance billing must also be included in that memo, as is any information on reporting a violation against balance billing. So a lot of information must be packed in that notice and delivered to consumers. Now, the U.S. Department of Health and Human Services, Department of Labor, and the Treasury Department have issued model disclosure notices that healthcare providers and insurance companies can copy. They can use those model notices that satisfies the requirements in the rule, but of course they can come up with their own if they want to. Now, providers and facilities on the healthcare side must furnish the notice and consent documents and the disclosure notice as of January 1st, 2022. On the insurance side, insurance or group or individual health coverage must furnish the disclosure notice for plan or policy years beginning on or after January 1st, 2022. Now, that complaint line we mentioned starts January 1st, 2022. The U.S. Department of Health and Human Services, again with the Department of Labor and Department of Treasury and the Office of Personnel Management, will operate a telephone line for individuals to submit complaints regarding potential violations of the No Surprises Act. It is up to the U.S. Department of Health and Human Services to triage those calls to the appropriate federal agency. And in the description below, we give you the phone number that will be activated as of January 1st. Also in the description below, we share with you that memo that came from CMS.